Hi, everyone. My name is Allison Gottermeyer. I'm the Multimedia Public Relations Specialist here at Sarasota Memorial Healthcare System. We regularly receive questions from the community about stroke care and treatment and the symptoms of stroke and what people should be on the lookout for. So joining me today to answer some of those questions, I have Dr. David Stone, who is a fellowship-trained vascular neurologist, and the SMH Stroke Program Coordinator, Ben Doepker, who's an RN as well. So thank you both so much for joining me. Dr. Stone, I'm going to start with you. Who is most at risk of a stroke?
Hi, Allison. Great question. So stroke risk dramatically increases with age. So a well-functioning 80-year-old person has about a 1 in 5 chance of having a stroke in their life. However, young people are also at risk for stroke, especially given increases in obesity and diabetes. However, those who've had a prior stroke are very high risk. Estimated maybe 1 in 4 who've had a prior stroke will have another stroke in the next 5 years, with the highest risk being in the first few months after their stroke. And this cumulative risk can go up to close to 40% at the 10-year mark. And of course, this risk varies some depending on the underlying stroke mechanism, but it's quite high. Most strokes, however, can be prevented, probably 80% or more. So preventing a stroke is not only important for saving lives, but also preserving quality of life.
Absolutely.
For example, one of the best ways to prevent dementia is to prevent a stroke. High blood pressure is by far and away the greatest modifiable risk factor for ischemic and hemorrhagic stroke. So controlling blood pressure would be one of the best things that people could do to reduce the risk of having a stroke, and would probably almost eliminate the risk of hemorrhagic stroke. About half of all Americans have high blood pressure. Unfortunately, 1 in 3 don't even realize it. And it significantly can reduce life expectancy. So, a normal blood pressure is less than 120/80 for those who are not aware. In addition to, high blood pressure, as we get older, our risk for an abnormal heart rhythm called atrial fibrillation becomes an increasing risk. And it's a risk for large strokes. So that should be important to be diagnosed and treated. In addition to that, diabetes, high cholesterol, obesity, sedentary lifestyle, smoking, those with other types of vascular disease, such as those with coronary artery disease, carotid plaques, or peripheral artery disease, those who use excessive alcohol, illicit drugs, also have increased risk for stroke. And of course, there's some patients with special populations with vascular trauma, inflammatory disorders, some infections, and genetic syndromes, which are much less common.
So my next question is actually for Ben. Many stroke survivors tell us that they didn't call 911 when they were having a stroke because they didn't feel the symptoms necessarily warranted that emergency call. What are the red flag stroke symptoms that people absolutely need to call 911 for?
So hi, Allison. Yes, absolutely. We frequently see people coming in with late arrival times to the ER where they delay coming in because they think that their symptoms are going to improve. So some of the symptoms that we see with the stroke populations out there is sudden onset of weakness on one side of the body or the other, a sudden facial droop, a sudden speech impediment, not able to speak. These are symptoms where you want to call 911 and you want to seek medical attention immediately. A lot of people that we see coming to the ER, I have discussions with them when I see them down there, and I'm like, why did you delay? Why did you not come in? And a lot of these people feel like the symptoms will just get better, or they're mild and they don't think it really warrants a visit to the hospital. Scary part about stroke is one single stroke is not the same as another stroke. All strokes present differently and no one is ever the same. So if you experience those symptoms with a sudden onset of a weakness, or you're not able to speak, or somebody has a sudden onset of confusion, really the word I want to stress is sudden. They should immediately activate 911 and seek medical attention and have that investigated. Even little strokes or little benign symptoms can eventually lead to a bigger stroke, and even in the course of a few hours can worsen very rapidly. So strokes can happen over the course of hours, minutes, days, but they can happen very suddenly, be very devastating. So you need to seek medical attention.
And it's also important to note, I think, that it's not just get someone to drive you to the hospital. Calling EMS is important. Can you talk about some of the things EMS goes through when they come out to a 911 call?
Absolutely. So everything starts with the patient recognizing the symptom, the person or the family member who's experiencing the event. So when you activate 911, a cascade of events happens after that. So you activate 911, the EMS, the paramedics are all going to respond. They're going to evaluate you, and they're going to be looking for those symptoms of stroke, especially after they interview the patient, they interview the family member. And if those symptoms kind of like are flagging them to make that assessment of stroke, they apply two different types of stroke scales. The first one's going to be what we call the Cincinnati stroke scale. And there's different types of stroke scales that different EMS companies use. But it's a scale that is applied to the patient and says, yes, we think this is a stroke. And then another scale is applied that says, yes, this is a possible major stroke, to where we need to bypass a primary center that can care for a lesser severe stroke. And we need to go to a comprehensive stroke center, which SMH is, to care for this more severe stroke, where we can offer different therapies. So, and after they arrive and we have that kind of like that heads up, the team can assemble and be ready for you. You know, if you arrive via EMS, where if you just come in via triage or if you drive your car in, we don't have that heads up, and it takes longer for that team to get together to treat you.
Being that SMH is that comprehensive stroke center, like you just mentioned, can people choose where they're taken when they're picked up by EMS, or is it just too important to get them to the closest hospital?
They're always going to be given a choice. Now, when the EMS gets there, they're going to, again, apply those scales. And if they see a very, very severe stroke, they're going to take you to that comprehensive center. But if that stroke is not scoring as high as a severity, and they say, I want to go to my primary center, where it's not a comprehensive center right across the street, they then could take you there and treat you there as well. So it's really important that that the patients and the family members and whoever's involved in this stroke kind of listen to the guidance of the EMS, because they have been highly trained on this protocol, and it is very evidence-based and backed up, and it's observed all over the country. So yes. Dr.
Stone, can you talk a little bit about what happens when someone does come to the hospital with a stroke?
Sure, that's a great question. So first of all, as Ben mentioned, that call from EMS is very important. That gives us the heads up that a stroke patient is coming to the hospital. Then we have a team of doctors, nurses, pharmacists, technicians, phlebotomists, et cetera, who are there waiting right inside of the ambulance bay doors to evaluate the patient. We do this very rapidly and quickly. Then we get that patient off to a CT scan or MRI and get a blood sample really quickly within a matter of minutes, and interpret and make those decisions very quickly so that we can administer various treatments in real time. Once we're able to make an appropriate diagnosis, we rapidly move to get all those treatments made and into the patient. After if that stroke patient is a candidate and they get an acute therapy, and we have them stabilized, then they're admitted to the hospital for further testing. So they have very close monitoring. They have treatment within a specialized stroke unit of the hospital. And during the hospitalization, we work very hard to figure out why the patient had a stroke. We do this in order to treat the underlying cause of the stroke and to identify and manage any risk factors that patient may have through education, medications, et cetera. And this is to reduce the risk of having another stroke. There are various acute treatments as well, which we can discuss.
Yeah, what are some of those treatments? Because as Ben mentioned, every stroke is so different. How do you go about deciding what treatment is right for what patient?
Yeah, so there's been a lot of advances, especially over the last decade, in acute stroke care. And it's becoming more complex and individualized to each patient in their particular situation. So one big treatment that we have is tissue plasminogen activator called TPA. This is an intravenous medication that's given to eligible patients quickly after their stroke to help break up a blood clot that's causing that brain tissue to not have blood flow, and where those neurons are quickly dying. There's also some surgical procedures that we can do to remove larger blood clots called mechanical thrombectomies. And those can be used either by themselves or in combination with tissue plasminogen activator to treat acute ischemic stroke. We also carefully target blood pressure management depending on the type of the stroke and the mechanism, the blood sugar and the temperature as well. In addition, for some select patients, they may be candidates to enroll in a clinical trial, and we have additional therapies that we sometimes offer to other patients as part of trials. If there's a hemorrhage in the brain, really blood pressure management is the most important part there in identifying why they had a bleed. And that brain bleed expands really rapidly in the first few hours, so it's extremely important that they get here soon and are treated as well. For a specialized type of stroke, hemorrhagic stroke called a subarachnoid hemorrhage, these are very deadly types of strokes, and we also do advanced imaging to try to figure out if they had a ruptured aneurysm and then see if they need a surgical procedure to repair that aneurysm and then admit them to the hospital for further care. Furthermore, if a patient is on a blood thinner, certain blood thinners, and they have a hemorrhagic stroke, we do have antidotes for those. So we can give them certain drugs to reduce the extent of the bleeding within their brain. And then we give them therapies to prevent complications. So watching for aspiration, support their airway if they're not able to breathe on their own. And then for those who are not candidates for some of those other acute therapies like mechanical thrombectomy or TPA, we provide other medications and treatments such as aspirin, other antithrombotics, cholesterol lowering agents, blood pressure medications. They may need a surgery for their carotid arteries, depending on the underlying condition.
You spoke a little bit before, Dr. Stone, about who's at risk of a stroke. Now I want to know, what can people do to reduce their risks? Do you have any prevention tips?
Sure. So by far and away, the most important thing you can do is have a primary care provider and talk to that primary care provider about your vascular risk factors. By far and away, as I mentioned, high blood pressure is something that's very easy to control, and it's a great risk factor. So making sure you know if you have high blood pressure or not, and then treating it and following the advice of your primary care provider and following up with them, checking your blood pressure at home and make sure that it's within goal is very important. Eating a good, healthy diet, it may depend on your underlying conditions, but probably for all comers, something like a Mediterranean diet has been shown to reduce the risk of stroke and heart disease. So that's something they can do. Having an active lifestyle. The less time you're sedentary, the better. Obviously, don't smoke cigarettes. For those who drink alcohol, no more than 1 drink a day. For women, no more than 2 for men. And if you have any history of alcohol abuse, no alcohol whatsoever, of course, that would be hard.
All right. Ben, we know that those who have had the stroke have a much higher risk of having a secondary stroke, as we've mentioned. So are there resources or support groups for stroke survivors that can help them manage that increased risk?
Yes, we have a very robust community program here where we have outreach projects run by Representative Wanda Jackson. We have such events as cooking classes where we teach people how to cook meals, such as the meals that would be involved in a Mediterranean diet. We also have community events where we have people from the public come meet and talk about stroke and stroke prevention. And we tend to kind of go out into the community and have these events at churches and synagogues and everything like that, and community centers where we can kind of discuss stroke prevention and then the signs and symptoms. So a lot of the events we've been holding here lately have all been on online platforms. So we have been reaching out to people via Zoom and Cisco WebEx more and more lately. So all of our stroke survivors are going to get these resources. The community can also go to the SMH website and also find these community resources as well.
Because there are resources for caregivers as well, correct?
Yes, there is. That's actually an interesting point, because most of these events that I go to, you have the stroke survivor that's there, and then you also have the husband, the wife, the son, the daughter, the people who are caring for these people, and wow, do they have a lot of questions. So yes, absolutely. Patients, survivors, family members, all included and invited to these events.
Great, thank you. It's important to note that people can find the dates of those at smh.com/calendar. Again, that's smh.com/calendar. Dr. Stone, Ben just mentioned that a lot of these events now are virtual. Of course, we all know that's because of the world we live in right now with COVID-19. Have you seen people postponing necessary treatment, like for stroke symptoms, because they're scared to come to the hospital in the midst of COVID?
Unfortunately, yes. I've had patients who didn't come to the hospital at the onset of their stroke symptoms, and they missed the opportunity for treatments to reduce disability from their stroke. I want to emphasize that the safest place for someone who's having a stroke or TIA symptoms is the hospital. We take precautions to limit the spread of all infectious diseases, including COVID-19. This includes testing, isolation of patients who have symptoms of COVID-19 using appropriate personal protective equipment. The staff have their temperature checked daily. We contact trace anyone who's come in contact with a patient who tests positive for COVID-19. A mask is placed on the patients when they come through the doors, and we're treating them. All providers and staff practice immaculate, hand hygiene, and this is to protect ourselves from the patient as well as them from us. I just want to reiterate that the risk of death and significant disability is much greater from stroke in a patient who's having stroke symptoms, and the risk of getting COVID-19 and certainly greater than the risk of dying from COVID-19. So they should not wait. It's unfortunate we don't have as many people who come to the hospital even before the pandemic who should be treated for ischemic stroke. And certainly I've had patients who told me that they didn't come when they could have because of that.
Yeah, you kind of alluded to this, but can you just expressly point out why it's so important that people who have stroke symptoms get that care immediately and how much it can change their outcome?
Yeah, so a stroke is a life-threatening emergency. There are a couple types of stroke you may know. We've talked about a little bit, ischemic and hemorrhagic stroke, but both of them cause permanent brain damage. A stroke causes approximately 1.9 million neurons to die every single minute. You don't have blood flow going to that part of the brain. That's over 13.8 billion connections in your brain. That significantly ages that person and causes disability and death. And we have therapies that can significantly limit the amount of damage that occurs to that patient's brain and disability that they're left with. But it's very important that these therapies are given soon. If the longer you wait, the less likely you'll already be a candidate for these therapies, the less likely they'll work, and the more risky they are. The people who get here very early after recognition of their symptoms and are treated very quickly do the best. And we literally look for ways constantly to reduce minutes off the time that is spent in us being able to get the patient, identified, diagnosed, and treated when they come in the hospital. So the sooner the better.
Great, thank you. Also, as you mentioned, stroke survivors often face disability, so they often need rehab or physical therapy after a stroke, if it was a more severe stroke especially. So what should a survivor look for in a stroke rehab facility?
Yeah, so if possible, if they have a rehab facility that's specialized, that have therapists with specialized training in stroke patients or have significant experience working with stroke patients, I think that's important because stroke patients have issues that are very unique to that population, and it can be helpful when a therapist realizes what the limits of that person is, the trajectory of the recovery, and the things that they can offer that patient to help them recover.
Great. Thank you both so much for answering these questions from the community. Before we go, Ben, I wanted to give you an opportunity. Is there anything you wanted to add or anything you think is important for our community to know about the resources or anything here at SMH and about strokes?
Just stressing the importance of calling 911 and that many of our therapies that we do offer here are time driven. SMH is also, we're very progressive in our research, and we're always looking at the latest evidence out there with stroke. So a lot of our new modalities of treatment incorporate that research and the latest evidence. So we're looking at a lot of different things. Stroke is a very dynamic, very evolving field of medicine. And here at SMH, we are always actively looking into the newest and the most current practices to apply to our populations, our stroke population when they do come. So make sure you call 911. Keep an eye open for those stroke symptoms. Remember FAST, which is face, arms, speech, time, and the sudden onset of any weakness in the arms, sudden speech issues, sudden vision issues, and sudden confusion or sudden balance issues. We want to call 911 and have that investigated, because those could possibly be symptoms of a stroke.
Dr. Stone, same question. We've talked about a number of things here today. Anything you want to add or anything you want to reiterate?
I guess I would just add that sometimes people have a TIA or a transient ischemic attack. That's where they have stroke symptoms, but they resolve fairly quickly, or that could be due to a mild stroke. But it's still important for that patient to come to the hospital, because that means that they are at a very high risk for stroke, as I mentioned. And the sooner we can figure out why that patient had that event, the sooner we can treat them effectively and reduce the risk of a major stroke. Again, do not wait.
Great. Well, Dr. Stone and Ben Doepker, thank you both so much for answering all of these questions. And we want to reiterate to everyone looking for resources to visit smh.com. We have a whole page, smh.com/stroke, for all of that information. In the meantime, everyone stay safe and healthy. And remember, as Ben said, be fast when it comes to stroke. Thank you both and have a great day.